Two kinds of emergencies can occur in people on insulin. The first is a low sugar reaction. What might happen is, let us say there is a morning dose and a night dose. Let us say morning, just for argument's sake, morning you are supposed to take, let us say 30 units, night you are supposed to take 10. So, you are taking 30, 10, 30, 10, 30, 10, 30, 10. One day you took 30 in the night by mistake, you forgot, automatic behavior, you are thinking of something, you just loaded 30 thinking in the morning, you injected now. Now, if you have taken the morning dose at night, you are definitely going to get a low sugar reaction that day. Okay. If you have realized it, that is fine, you can immediately eat something or do something and so on. You have not realized it, you took double the dose, triple the dose and you slept off and you went into a diabetic coma. Okay. In the sleep itself it went off in diabetic coma, it can happen. Okay. It is quite frightening when it happens. Actually it is not dangerous, it is frightening, because if you give the glucose they will wake up immediately and they will become okay. But the family member should know about this, that a low sugar reaction can occur. And then immediately if they give them, if in the early stages or the patient says, look, I have taken this extra dose, I do not know, so keep looking out. So, even before that itself the family member can be alerted to help this person and can take either a glucose drink or a fruit or something and then prevent the low sugar from occurring, and keep checking on that patient in the night to see whether everything is okay. So, that way you can do that. The opposite is less common, high sugars, and the way that happens is usually it is deliberate. You do not forget to take your insulin, and even if you forget to take one insulin nothing will happen, but if you forget, you deliberately, some adolescents and all that, teenage, they will say I am going to, they fight with their mother or father, they say I am going to take insulin next 2 days, and then they will say they are taking and they will not take, sugar will go high, high, high and they will end in a diabetic coma. Okay. That is an emergency and that can be a life and death situation. So, when that happens immediately you have to rush to, low sugar can treat at home, high sugar you have to rush the patient to the hospital. You cannot give insulin and drips and all that in the home, rush to the hospital, see that drips are started, saline is given, insulin is given, blood sugars are checked, and then you can bring the patient out of diabetic coma. Today nobody should die, nobody should develop diabetic coma first, they should be taught to do that. If they develop, it can be treated also. So, these are, yes, of course they are emergencies, but they are treatable emergencies.